I want to say right off the bat is that I'm actually here tonight filling in for my colleague and dear friend, Candace King, and all rights and credit due. This is her presentation, which I have tweaked a little bit to make it mine. But I would probably say that she is the true expert on Medicare. My expertise is probably more commonly on the Medicaid side, but I think that I am sufficiently knowledgeable to be able to do this topic justice. I'm going to certainly do my best. If we get into an area of sufficient detail that I think that I may want to call upon Candace to be able to give you the best and most detailed answer, she has expressed willingness to take questions offline. She's actually at her son's wedding right now. So if we do have that circumstance, I'll collect your question and connect her with you to be able to make sure she can give you a really thorough answer. But in the meantime, I will go ahead and get started. As Ashley shared, we're going to focus primarily on Medicare Parts A and B and a little bit on Medicare supplements or Medigap plans. We'll speak very, very briefly about Part C and Part D, but not in the level of detail that it really deserves. So with that, I'm going to start moving through here, and I'll start by talking a little bit about the DuPage Federation, because as that slide that we were just on shared, this is a DuPage Federation presentation. The DuPage Federation is a nonprofit planning organization based here in DuPage County, but it serves the metropolitan area. I'm actually a board member for the DuPage Federation, have been for a very long time. They provide community planning and data analysis, training, technical assistance, presentations like this one, and they also have a language access resource center that provides interpretation and translation services and a host of other resources to the community, to hospitals like Northwestern, and to other organizations like my own. I run a nonprofit here in DuPage County called the DuPage Health Coalition. We coordinate health access for low-income, uninsured, and underinsured residents of the county through a number of programs, Access DuPage and others. And that's why I would say that my expertise is more on the services for individuals who don't have insurance or who are enrolled in Medicaid. But oftentimes those folks, as they get older or because of the nature of their disabilities, may ultimately qualify for Medicare. And that's where my expertise on the Medicare side comes in. Objectives for today. We're going to provide a general overview of Medicare, eligibility, the process of enrollment. We will talk about the initial enrollment process for individuals who turn 65 or who qualify because of a disability. We'll talk about special enrollment processes, circumstances where someone might qualify for a different reason. And then we'll talk about open enrollment, which happens every year. Then we'll talk a little bit about the benefits themselves, with more attention paid, as we discussed, to Part A, which commonly is thought of as hospital coverage. A good bit of attention also paid to Part B, which people commonly think of as doctor or outpatient coverage, but which actually is a little broader than that. We'll spend a little bit of time on Part C and Part D, prescription drug plans, and what commonly is thought of as managed care coverage. And then we'll actually spend a little bit more time on Medicare supplemental insurance or Medigap coverage, because oftentimes it kind of goes along with Part A and Part B. And then we'll end up talking about Medicare assistance programs, additional resources that can be sometimes available to individuals that can make Medicare less expensive or add additional benefits or resources. And then also some extra programs that are available out there that can make it easier to help identify what plans or programs might be best for someone when they're trying to sort of navigate through that process. So first, the basics. Who is eligible for Medicare? I think everyone is conventionally thinking about Medicare as a program that serves individuals as they get older, individuals age 65 or older. But that is just a piece of the puzzle. It's the largest piece, but not the only piece. Younger individuals who receive Social Security disability benefits, who are deemed to be disabled and who have been disabled for 24 months or longer, also qualify for Social Security. There are also special programs for two different disease states whereby people will qualify for facilitated or sped up coverage for Medicare, and that's individuals living with kidney disease that has reached a level of acuity or seriousness that renders them eligible for Medicare, and also individuals with Lou Gehrig's disease, otherwise known as ALS. Those are all of the categories for which someone could qualify for Medicare. How is Medicare organized? We sort of touched on this earlier with all of these different alphabet soups, as you may think of it. But Part A is both hospital coverage, that's what is commonly thought of, but also services that are intended to keep you out of the hospital. So hospital stays are covered by Part A, but also skilled nursing care. Skilled nursing care can sometimes sort of look and feel like hospital coverage, but it's in a different kind of facility, but requires a high level of care and support. But also hospice services. And hospice services could be provided in a person's home. It could be provided in a community setting. It could be provided in a hospital setting, in a hospice unit or ward. But it is also intended to be an alternative to traditional hospitalization. And home care services are also covered under Part A as an alternative to hospitalization, allowing someone to be at home or in the community instead. Part B, conversely, is sort of those things that don't fall into Part A, and that's really outpatient services, doctors' care, both primary and specialty care services, surgery, preventative services, and lab services. Those are the things that most commonly fall into Part B. That prevention piece is something that people don't tend to think about. It's also something that's been expanding over time. Part C is actually kind of a combination. Part C is really the combination of A and B put together in sort of a novel package, but then with the addition of some extra services and with the benefit of having more predictable costs. So people have some options, like a menu that they would choose from at a restaurant, where they can select uh, a Part A plan and a Part B plan and a Part D plan and perhaps even a supplemental plan. And I'll show you this on a schema in a moment. Or in lieu of that, they can actually put that A and B and D together in a C plan that sort of bundles all of those pieces together into one plan that's oftentimes provided by an insurance company that's bundling all of those pieces together and trying to make the costs more predictable for the consumer so that they know what to expect on a month-to-month basis. So let's talk a little bit more, though, first about what Part A covers. We said that it covers inpatient care in a hospital or in a surgical center. We talked about the fact that it covers skilled nursing facility care, but there are some rules about this. And I don't expect that you would necessarily remember these rules, but I guarantee to you that the skilled nursing center remembers them and also that the hospital or health system is remembering them as well. Because if they don't follow these rules, ultimately Medicare will not cover the costs of the care that was provided. For a skilled nursing care bill to be covered, first, it has to be deemed to be medically necessary, that skilled nursing need needs to be present when the person is transferred into a skilled nursing facility. And prior to the person being placed in that skilled nursing facility, they have to have had a prior 3-night inpatient hospital stay, and that inpatient hospital stay has to have met certain conditions. And then again, as we already spoke about, hospice care and home health services are also covered. Part A, costs. Conventionally speaking, and for most people, there actually aren't costs for Part A. Most of the time, for most people, you've paid into Part A your entire life by having employee costs associated with your payroll taxes that are covering your Part A costs. And then when you turn 65, or if you're deemed disabled, that Part A cost, that premium is already covered and you have zero premium associated with it. Basically, to qualify for a zero premium Part A, you or your spouse have to have worked for 40 quarters, which is 10 years full year round. So four quarters in a year, 10 years, 40 quarters. If you have worked for at least 10 years all year round, then you should, in most cases, have zero premium for Part A. If you don't qualify because you didn't work 10 full years, then you can anticipate that there will be one of two costs that would be assessed for you if you otherwise qualify for Part A. If you worked for 30 or more quarters, so you worked 3/4 of that requirement, so you worked for 7.5 years, then you would actually qualify for a premium cost of $278 a month. Steep, but there it is. And if you work less than that, it would actually be $506 a month for that Part A coverage. So it's not an insignificant cost, but in most cases, we are not paying it out of pocket because it was already paid by our tax dollars earlier in our lifetimes. If time permits, I can go into more of the costs, but there is a deductible of $1,600 for Part A in 2023. What does Part B cover? Part B covers medically necessary services to diagnose or treat medical conditions. So that includes outpatient services, doctor's visits, physical therapy, labs, imaging, outpatient surgeries, durable medical equipment, things like CPAP machines or canes or assistive devices of one kind or another, mental health services, and some limited and specific kinds of medications like chemotherapy are included in Part B. Not most medications, but some very specific medications. Under the Affordable Care Act, Part B was also expanded to include some preventative services, healthcare that was intended to prevent an illness or detect it at an earlier stage. So physicals and certain other screenings and tests and things that were intended to be promoting of early diagnosis and treatment of conditions were then included as a part of Part B that historically had not been necessarily included. Part B costs for 2024 have not yet been finalized, but it's pretty close. This is a pretty close estimate. In 2023, I think the costs were $164 and change, and it's predicted that the costs in 2024 are about $174, just under $175 for the standard monthly premium for Part B. But this is a place where your income actually matters a great deal. And I grabbed this because I was not going to remember it off the top of my head, and I wanted to give a little bit more of a sense of just how much it matters. So I have the 2023 numbers here in front of me. If you made $97,000 or less for an individual, or for a household, joint tax filing of $194,000 or less, you would pay $164.90 for the individual premium for Medicare Part B. But if you made between 97,000, I'm going to just look at the filing individual tax return now rather than going through all of those. If you were an individual making between 97,000 and 123,000 instead of making less than 97,000, your premium would go up to $230. And if you made between 123,000 and 153,000, it would go up to $329. And it keeps going up, and it goes all the way up If you make $500,000 or more a year, your premium actually goes all the way up to $560 per month. So there is actually quite a bit of variability in that Part B premium depending on your income. It is not, in fact, fixed at that $164 in 2023 and probably $174 in 2024 number. That varies based on income. I did not, I apologize. Annual deductibles. There is an annual deductible of $226 in 2023. After that $226, if you just have a traditional Part B and you haven't chosen a Medicare Advantage plan, then Medicare covers 80% of the approved cost of services, and the patient is responsible for the remaining 20%. That's sort of a co-insurance model. And that means that the out-of-pocket costs will vary dramatically depending on the services that you receive. If you have relatively few services, your costs will be relatively modest, but that also means that if you have a lot of needs in a particular year, your cost can actually be quite high. And that's really, I think, one of the reasons, among others, that so many people opt for a Medicare Advantage plan or a supplemental plan as a way to try to provide some protection against some of those unknown costs that they may find difficult to absorb should they find themselves with more significant medical needs. Ashley, let me know if you want me to pause for a question, okay?
Actually, I do. That was wonderful
Okay,
timing.
cool.
We have a question here.
Sure.
Is that premium for Part B based
Yeah.
on earned and unearned income or simply the earned income level?
Oh, that's a great question. There are definitely some components that are not included. I know that there are elements that are exempted from consideration, but there is also unearned income that is still included. That's a great example of a place where I will get you a link to uh, a table that would actually tell you precisely what's included. Let me make a note to myself so that I can find a place where you can actually say, this is what will be included and this is what will not, because it isn't just a question of traditional earnings that you're making from an employer in that particular year. It's also going to be consequences of past earnings as well. Income on which, and this has impact presumably not just on the Part B components, but there are some other places, Part D and others, where there are also variable premiums based on income. So those same rules are likely to apply in those categories as well. So when I get the question answered, I'll make sure that it speaks to all of them.
Thank you, Kara.
Premiums. Great question. Okay, now we will turn our attention to how and when to enroll in Medicare. And this, as in all questions, the answer is it depends. but really, it's not for bad reason. It's for good one. There are a host of different enrollment periods and opportunities, and they all sort of apply to different conditions. So first, there's the fact that we will all turn 65 at a different time. And at each of our 65th birthday, we will have an enrollment period that is specific to us. But in addition, if you become eligible for Medicare as a consequence of a disability, you will also have an enrollment period that is specific to you that falls 24 months after you were deemed to be disabled. And I'm actually going to show you some charts that detail this in more specifics. So I'm going to go over this broadly here, but the next few slides are going to go into it in more detail. So initial enrollment period at age 65, and there's a window where you can enroll. And then after you are found to be disabled, you will have a special enrollment period specifically after 24 months of your disability, and you'll have a window that you can enroll. And then every year, there's an annual enrollment period in the fall where people can enroll or change their enrollment from one service to a different service. And that sort of is an open process for lots of people that sort of comes every fall like clockwork. So let's talk about the initial enrollment period first. So the month of your 65th birthday, my birthday is in May. So the month of in May is my actual 65th birthday. But for the 3 months prior to my birth month, so April, March, and February, and for the month of May, and then for the 3 months that follow, so June, July, and August, that will be my initial enrollment period in my 65th year. So I will actually have 7 months where I can enroll because I turned 65. And they will, in the center of it will be the month where I actually turned 65, but the 3 months before I turned 65 and the 3 months after I turned 65 will also be included in that initial enrollment period. Even if you're not eligible for Social Security yet, because many of us will not necessarily qualify for Social Security or elect to take Social Security at our 65th birthday, you still qualify for Medicare at 65. If you don't sign up during that initial enrollment period, under certain circumstances, there may be penalties. So it's important to understand what those penalties are and when they apply so that you can make an informed decision about whether or not they apply to you and what to do about them. You don't always have a penalty, but under some circumstances you could. We'll talk more about that. Sorry, guys. There we go. Now let's look at the disability initial enrollment period. So this is again that situation where you were found to be disabled and as a consequence of your disability, 24 months later, you are going to qualify for Medicare. Under that circumstance, you're now receiving Social Security disability benefits and your Medicare A and B eligibility will start after you've received that SSDI for 24 months. Again, you will have 3 months before the month of and 3 months after the month of. So again, this 7-month window that you're automatically going to get A and B because of your disability. But that 7-month window is the time where you can choose whether or not you want to enroll in a supplemental or Medigap plan, whether you want to pick a Part D plan, or whether you want to enroll in a Part C plan, a Medicare Advantage plan. So that 7-month period is still quite important to you. You're already going to automatically be getting A and B, but this is the time where you can sort of look at the full menu of options and decide what is the best option for you. Here's where we're going to talk a little bit about penalties and what happens about when you can delay Medicare enrollment. Let's say it's your 65th birthday and you haven't retired yet. And you're still working and you work for an employer that offers a medical benefit that you enjoy and want to continue to take advantage of. It has low out-of-pocket costs. It's a good fit for you and you want to continue to use it. Continue if your employer will allow you to continue to use their insurance once you turn 65. And some workplaces require that you enroll in Medicare once you qualify for it. But if you don't work for an employer that makes that requirement, you can elect to delay your enrollment into Medicare A and B based on the fact that you have credible employer-sponsored health insurance. And you will not, under that circumstance, have a penalty for delaying. You had a solid reason for not enrolling, and provided that you can prove that you had that solid reason for not enrolling, you will not face a penalty later when you enroll. So that's the reason why you could elect to delay your benefits without taking a punishment later for doing so. Could spouse's employee-based insurance also qualify? Yes, I believe and this is a place where you'd want to, I would encourage you to confirm this, but I believe that your spouse's coverage would qualify as credible coverage and allow you to postpone um, uh, the coverage, your enrollment in the next plan, provided that, again, that the employer allows you to stay enrolled in that plan at your 65th birthday. Okay. In that event, when that coverage ends, if you delayed enrollment into Medicare A and B due to having credible workplace coverage, then you can qualify for a special enrollment period when it's time to enroll in Medicare. In that case, that special enrollment period is usually 8 months after the end of the working. So this one is a little bit different than that 7-month window that we were talking about before. This usually is 8 months. So let's say that I ended work on December 31st of 2023. Commonly, I would have 8 months. So I would have, until August of 2024 to be able to enroll in Medicare and be within my special enrollment period. And there are forms that you have to complete that certify the prior employer health insurance and request the date for your benefits to start with Medicare. And the website that you go to is medicare.gov to complete those forms and submit those documents. But I want to note that you do not have to wait. You're not required to wait, and you're certainly not, it's not to your benefit to be without coverage for any portion of that time. If you're in a position where you know and can anticipate that you're going to lose employer-sponsored coverage on date X, the wise thing to do is to go ahead and preemptively get started on that Medicare process so that you ensure that you have no gap in coverage. You're eligible to start that process earlier before you stop working. You can go ahead and get that started as soon as you wish to, and you could in fact start on the first day that you're not working, or in fact could even start, as I understand it, a few months before the end of your employment. The documents will give you more detail about it, but there is more flexibility in terms of that start date. Now let's talk a little bit about Medicare open enrollment. That's that annual period that happens each and every year. And most commonly, people are actually probably using that to make changes in their coverage. I mean, there's some people that are turning 65 during that period, but that's sort of a coincidence, right? Medicare open enrollment period begins on October 15th and continues through December 7th every year. So we're just a little less than 2 weeks from its beginning. And coverage for any changes or enrollment that happens during that period actually begins on January 1st of the next year. So, and anything that happens between October 15th of this year and December 7th of this year, those changes will take effect on January 1st. During that period, you could enroll in coverage for the first time if you hadn't previously done so. You could move from traditional Medicare, say you were in Medicare Part A and Part B, and decided that you wanted to move into a Medicare Advantage, a Part C plan. You could do that during that period. Or if you were in a Medicare Advantage plan and decided you wanted to shift back to a traditional A and B plan, you could make that shift during a Medicare open enrollment period. You could change from one Medicare Advantage plan to a different Medicare Advantage plan, or you might, in some circumstances, be able to select a supplemental policy. And if you were in a penalty phase because you had not signed up in a timely period for some other reason, that would be an opportunity to sign up because you were not able to sign up during other periods because you were out of compliance, in effect. This is a time to get yourself back on track. Hopefully it's a little bit bigger on your slide than on your picture than it is on mine, but this schema is just to show you that you have some options about how you want to get your Medicare. And on the left-hand side, what you can see on that menu is sort of the a la carte options, where you have that hospital coverage that we were talking about, that includes hospital and hospice and home care services and skilled nursing under certain circumstances. And then you have Part B, those doctors coverages and lab and some preventative services, some very select specific drugs. And then you have the Part D services and Medigap, which we're going to talk a little bit more about, but they're otherwise known as supplemental plans. And that's where you sort of pick, you just sort of say, yep, I'm going to take Part A, I'm going to take Part B, I might take Part D, and maybe I'll take a Medigap plan. Or you can choose the option on the right, which is a bundling of all of those options into one plan. And in that case, you're picking one carrier that bundles A and B and commonly D all into one bundled offering that offers all of the services of A and B, select portions of D, and sometimes some extras, some things that might not otherwise typically be covered. Things like sometimes some dental services or some vision services or some extra perks or resources that you might not otherwise be able to get. Let's talk a little bit more about the penalties, though, that we talked about earlier. We said that for many people, there is no penalty if you don't. I'm sorry, we said earlier that commonly there is no premium for Part A, the hospital coverage, that for many people, Part A is a premium-free program. But for some people, there may be a premium associated if you hadn't worked a lot of quarters. If you're a person that does have a Part A cost and you don't elect Part A when you have the option to do so, there is a penalty assessed to you if you try to elect it later. And that penalty is effectively 10% of the monthly premium that you are being asked to pay. That premium that was $270 or $506, depending on whether or not you'd worked 30 quarters or if you'd worked fewer than 30 quarters or worked between 30 and 39 quarters. If you have to actually pay that Part A premium and you didn't sign up for Part A in time, let's say you signed up 2 years late. If you signed up 2 years late and you were being asked to pay, I'm going to round here to make the math a little easier. Say you had that $500 a month premium for Part A and you waited 2 years to sign up for your Part A. The penalty is 10% of your monthly premium. So that is $50 is your monthly premium, and you will pay that 10% additional, so that extra $50 for twice the number of years that you would have had Medicare Part A but didn't sign up for it. So you waited 2 years and you have a $50 penalty. And so you're going to pay it for twice as long as you waited. So you're going to pay that $50 penalty for 4 years. So instead of paying $500 a month, you're going to pay $550 a month for 4 years before it goes back to the $500. That's how they handle the penalties for Part A, which is unpleasant, but probably not devastating. But we're going to talk about Part B in a minute, because Part B can be really steep. And this is the place where you definitely want to make sure that you don't blindly miss or accidentally fail to think about the consequences of failing to enroll in Part B when you're eligible for it, because these penalties can really be painful. Part B penalties. If you fail to enroll for Part B when you first qualify, or after employer-sponsored credible coverage ends, the late enrollment penalty added to Medicare Part B premium is different than the one that's added for the Part A, excuse me. You have to pay the late enrollment penalty plus your normal premium forever. So that's the first piece. This extra payment never retires. The Part A, you just pay it for a few years. For the Part B, you pay it for as long as you have the coverage. And the penalty amount is a 10% penalty for every year that you waited. So if a typical premium for Part B is $175, again, I'm rounding to keep the numbers easy, and you waited for 5 years to enroll in insurance, that would be $17.5 a year that you would pay as a penalty, and you waited for 5 years. So 17.5 times 5 is $87.50 would be your penalty that you would have to pay every year forever because you failed to enroll 5 years earlier. That you would pay on top of the $174 that was already your premium. So you basically increased your premium by 50% by waiting for 5 years to enroll in that coverage. It's steep. So you just want to go into it with your eyes wide open if you're choosing not to take the coverage when you qualify for it. There may be circumstances where it makes sense to not take it. And again, if you have an employer option where you won't face a penalty, then that's a solid reason to wait. But just make sure that you've gotten good guidance if you're making that decision so you don't get caught unaware and have to face a steep consequence. So I said we were going to talk a little bit about these Medigap plans, and I'm going to go back and just show you again on that menu that we were looking at here. Medigap plans are at the bottom left of that little schema there. These are these Medicare supplemental insurance plans that they sometimes help pay out-of-pocket costs associated with Part A and Part B and sometimes even Part D. So they can sit on top of A and B, even if you don't have a Medicare Advantage, like a managed care Medicare plan. So how do Medicare supplement plans work? First, you have to have Medicare Part A and Part B to be able to have a Medicare supplement plan, but they can help to pay the deductibles and the coinsurance. You can't have a Medicare Advantage plan and a Medicare supplement plan. It's an either or. You can't have both. But basically what happens if you had a Medicare supplement plan is that you visit the doctor bills Medicare, and after Medicare pays, then your Medigap or your Medicare supplement plan can kick in and pay all or some of the difference, leaving you with either no remainder or a smaller remainder that's your responsibility. These supplement plans, one of the nice things about these supplement plans is that they have sort of graded offerings. And what it means is that the plans, there can be a list of A plans or N plans or G plans or B plans. And if it's a D plan or an A plan or an M plan, it means that certain things should be true of every M plan and certain things should be true of every A plan. And you should know going in that if you're looking at an A plan, every A plan will offer the same menu of services. And really what you're looking at is some differences in cost that are based on the carrier. It may be how the carrier is assessing risk. It may be on certain very minor details about how the carrier is pricing the plan. But there should be some relatively similar offerings from one plan to the next. And so that's designed to be sort of a consumer protection. The costs are a monthly premium for that supplement plan. Plans A through N will cover different services at different rates for varying monthly premium. But like I said, plans with the same plan letter sold by different insurance companies. The price will vary, but really cost should be the only major difference because they should offer the same broad categories of coverage. And of course, the more comprehensive the policy, the more it covers, the more the premium will be. There are different pricing methods for different kinds of plans. And for good reasons, different pricing methods will be more or less attractive to someone. An attained age pricing method means that as you get older, each year, the premium is going to go up. So the plan will be less expensive at 65 than it will be at 75. And you have to sort of budget for those increases year over year. Most insurance companies do actually follow that pricing method, but you can sort of price yourself out of being able to afford them in certain, if you don't necessarily have the ability to absorb those increased costs year over year. There's also plans that are based on issue age, which means that if you stay in the plan and you enroll in that plan at 65, it never goes up. As long as you stay enrolled, someone who enrolls at 65 will pay the same amount forever. Someone who enrolls at 70 will pay a different amount, but the same amount forever. Someone who enrolls at 75 will pay a different amount, but the same amount forever. And then there are plans that are called community plans. And in those plans, the premium is the same for everyone over the age of 65, regardless of age. But attained age, those plans that change by age are the most common. Issue age are relatively infrequent. And then AARP and United Healthcare offer those no age community plans. The best time to get a policy if you're interested in a supplement plan is during your initial enrollment plan. You'll have the best choices and the best options. When you turn 65, you'll have the best opportunities. You'll have 6 months to enroll in a supplement policy. It says 6 months, you guys, if I'm being honest, I think it's 7. I think that when they're saying 6 months here, I think this is another example of that pre and post where you have 3 months before your birthday, 1 month of your birthday, and 3 months after. Don't quote me, but 3 months pre, 3 months post should mean that there's a 7th month in there that's actually your birthday month as well. I don't know why this would be different than your initial enrollment for everything else. You can purchase any policy sold in your state, even if you have health problems. So that's why picking these plans at 65 can be a really attractive option because there won't be a penalty based on your health history. And this can be a really financially important decision because as you get older and as your health history changes, some of those options may go away. If you're under 65 and you're disabled, one of those other circumstances where you may qualify for coverage, in Illinois, you have the same open enrollment rights as people 65 and older. It can change if you move to different states. Different states have different rules about this. So in some circumstances, you may find that other states don't have the same protections. And it would be a good idea if you're moving from Illinois to a different state, or if you are someone who perhaps lives in multiple states, that you analyze the rules of that state. And it may be that you have some benefits of declaring one state to be the state that is your dominant residence, to be able to take advantage of the benefits of that state. But Illinois has relatively protective benefits in this regard. So in someone who's under 65 and disabled, when you turn 65, so you get an initial enrollment period because of your disability status, And when you turn 65, you get another open enrollment period, just like any other 65-year-old. So you get two open enrollment periods, um, uh, whereas individuals who are Medicare eligible only because of their turning 65 would get the one. So there's actually two categories under which you would have a special enrollment or an initial, excuse me, the right term is an initial enrollment period. To enroll in supplements, you simply contact the insurance company that you want to purchase the policy from. But at the end of this presentation, I have 6 or 7 pages worth of links to different guides, benefits, and resources that Ashley is going to share with everybody who's on the call today. There are some great guides to supplements and to Medicare Advantage plans and all of the above. And you can use those to sort of get the contacts at the insurance companies and others. Okay, assistance for Medicare costs. I'm not going to go into a lot of detail about this. What I really want you to know is that these programs exist, so that if they are something that you might qualify for, or if you encounter someone else who might benefit from them, you know to look into them. Medicare savings programs are joint state and federal programs that give people extra help paying their Part B or Part D premiums. And it's based on income. There are actually 3 different programs, uh, and all of them are income based, and it's literally a numbers game. But in each case, they help people to pay their premiums or their out-of-pocket costs, and so they can reduce the costs associated with healthcare. And if your income is limited or you know someone whose income is limited, it's important that they know about these programs, because it can significantly ease the process by which they are able to afford the health care that they need. There are also some extra benefits, like allowing them to enroll in Medicare Part B outside of usual enrollment periods, eliminating some of the penalties for late enrollment, automatic enrollment and extra help for Part D, and potentially eliminating the need for supplemental or Medigap policies, because those Medigap policies are intended to help with coinsurance and out-of-pocket costs. And these Medicare savings programs are actually covering those costs. So you probably wouldn't need that supplemental plan to help with them. We're getting towards the end here, by the way, guys. I mentioned that there are some extra resources out there to help people when you're trying to navigate through. This is a maze. And part of what makes it a maze is that especially as you get closer to your 65th birthday, you're going to get an awful lot of people reaching out to try to help you make a decision about one insurance offering or another. And it's bewildering. And a lot of them can sound awfully alike. And there's frankly some spin associated, and you really want to be an informed consumer and you want to not be taken advantage of. And so I want to make sure that everyone's aware of the SHIP program, because the Senior Health Insurance Program is a network of highly trained volunteers. They are available in every county. We have them in DuPage and also in Kane. This is one of the slides that Ashley will share with everybody tomorrow, with the names and the phone numbers of locations that have SHIP counselors in DuPage and Kane both. But effectively, these are folks that go through a rigorous training, and who have absolutely no interest except to help people to make the best choices for them about what coverage will be of greatest benefit to them. They get absolutely no benefit from steering you in one direction or another. They're just volunteers trying to help people navigate what is oftentimes a very confusing maze. And in many cases, they are themselves individuals who are enrolled in the same programs that they're helping people to navigate through. So they've been there and they have great awareness and empathy for exactly how confusing it can be. So do not hesitate to reach out. That's exactly what they're there for. In DuPage, it's commonly the DuPage County Senior Services. It's only one name there, but that's because it's a really, really big group. But separately are the township offices and many of the municipal locations, towns and villages have SHIP counselors available. So plenty of resources. And then we also listed a number in Kane County as well. I think this is actually just about the last slide, but I want to talk about, you may have heard on the news, the Inflation Reduction Act got an awful lot of press, actually just in these last several weeks because it was passed into law earlier in the summer, but it actually was launched more officially just in the last several weeks. And the Inflation Reduction Act, among other things, included a number of key changes to Medicare. Some of them don't come officially into effect until January, but a number of them are very relevant to Medicare. And they include what is listed here on this slide and even a few others, but these are the highlights. One is that starting in January of 2024, if you have Part D coverage and your drug costs are high enough, if you can be considered in the catastrophic drug coverage phase, you will not pay co-payments or co-insurance for your medications any longer. Once you hit a certain phase, your co-payments and co-insurance will be capped. I'll talk a little bit more about medications here. The Extra Help program to help cover Part D drug costs will be expanded to cover more drug costs for certain folks with limited resources. Co-insurance amounts for Part B covered drugs like the chemotherapeutic drugs that we were talking about may also go down. And if prescription drugs prices are increasing faster than the rate of inflation, then there will actually be penalties against the pharmaceutical company and some relief passed on to the consumer. There will be lower costs for insulin and higher coverage for vaccines. Specifically, insulin costs will be capped at $35 out of pocket. So you will no longer be asked to pay more than $35 for an insulin prescription. And vaccines, if they are deemed medically necessary, will be covered by your Medicare. That should include COVID, flu, depending on your age and medical condition. It should include the Pneumovax vaccine. It should include the shingles vaccine and a number of others, depending on circumstances. They will extend telehealth coverage at least through 2024. Chronic pain will be covered at a more significant level. If you've been living with it for 3 months or longer, there will be improved access to mental health care. There will be some increased access to and broader, more generous ability to sign up for Medicare. And they will continue to provide additional assistance with some COVID vaccination and other COVID-related supports. There are also some other pieces that were a part of that aren't listed here, like, for example, the ability to negotiate the cost of Medicare of certain drugs that are purchased through Medicare. And that has been highly legislated. I believe that it is 10 drugs that they are now going to be able to negotiate the cost of. They had to select the 10 drugs in 2020. And I believe another 10 drugs in 2025. And so year over year, they will be working on taking those drugs that are most commonly used or most expensive and working on getting those costs to come down significantly as well. That's another Inflation Reduction Act related change. With that, these are some questions that are intended to sort of prompt people to understand the material that we just went over, but rather than going through these questions, I'd rather pause and invite folks if you have any questions, either things that I talked about or things that I did not.
And you all are welcome to unmute and ask those questions, or if you want to put them in a chat, whatever you prefer is just fine. No questions? Kara, you must have done a phenomenal job covering all
No,
of this
you're honestly,
information.
it's so much jargon. I completely get it.
Mm,
Um, Here, what I'm going to do is just show you really
so
briefly
sorry.
so you know what you can expect. That what Ashley is going to be sharing with you. First, what you're going to receive is a link to the DePage Federation's website, which has a lot of resources all by itself. Like I said, they provide training on Medicare and a host of other public benefits. It also has Candace. Candace King is the person who would commonly provide and who's the true expert on Medicare this presentation. Her email is here, so you could certainly reach out to her if you had a question. My email is also included. If you email me and I can't answer it, I will make sure to reach out to Candace. But also after that, these are some of the resources that I was referencing that are recommended as tools as you're working to navigate this. They are pictures of the resource, but also links to the resource themselves. Um, uh, Different guides to choosing Medigap policies, choosing Medicare supplement programs, websites that are helpful and provide easy to choose references and tools, Social Security guides, other helpful websites and resources, and then those senior health insurance program um, uh, references that I talked about as well. So those will be coming to you via email, and certainly don't hesitate to reach out. In the meantime, I will find out the answer to the question that was posed earlier, and I will share the answer with Ashley so she can in turn share it with you guys to confirm precisely upon which income they are deciding how a premium is assessed. So what is included in the determination of income? What is it? What is the gross income upon which premiums are being assessed? And I'll get that back to you.
Well, that is wonderful. Thank you, Kara, again for this wealth of information. Everybody on here as well, I will have access to your emails based on the roster here on Teams. So I will get that to all of you tomorrow afternoon, along with any, if you have any questions, I put my email in the chat too. So please feel free to reach out. And I know sometimes it doesn't hit you until the next morning or whatever it may be. So
For
I
sure.
know it can, it can be a lot. So this will also go up on our YouTube channel probably either tomorrow afternoon or Wednesday. So if you wanted to refer back to it, you certainly can. So that's another way